Hello, and thank you for joining me today. My name is Scott Richardson, and I'm a doctor of acupuncture and oriental medicine. Today we're going to be doing a demonstration of dry needling for shoulder stability. We're going to be going in and stimulating the rhomboids, the trapezius, infraspinatus, and deltoid using a dry needling style technique. It's important to note that the instrument used are acupuncture needles. They are all sterile, single-use, disposable needles. The patient's skin was prepped according to clean needle technique before we did any insertion. And again, we're going in and we're helping to stimulate these muscles to reduce pain, reduce inflammation, and create shoulder stability. So let's begin. So we are treating the shoulder, and we are going to be going into the rhomboids, trap, infraspinatus, and deltoid. Starting with the rhomboids, it is important to note that the skin has been prepared according to clean needle technique, and all the instruments are sterile, single-use, disposable needles. Palpating along the medial border of the scapula, we do a quick insertion, and then we go in looking for a fasciculation of the muscle. There we go. And we are mainly hitting rhomboid major, but we're getting a little bit of minor, especially at that attachment. There we go. And the response that you want is kind of a dull, heavy, achy sensation, and that will note that you are getting the response that you want. Next, we are going into the trapezius muscle. This is done wrong all the time. You need to make sure that you are going with the fiber of the muscle and not a posterior to anterior insertion. So I start just a little bit lateral insertion. I like to place my fingers, and you can see the fasciculation happening, but I like to place my fingers on the anterior and posterior border. That way I know where the muscle is. We've gotten a couple of nice fasciculations in there. That way you know that you're not passing through the trapezius muscle, that you're staying within the muscle body itself, and again, not going any further than the muscle boundary. Next, we are hitting infraspinatus. This is commonly noted as small intestine point 11, a very crucial point for shoulder stability. In Chinese medicine, they say it stabilizes the shoulder, and when properly stimulated will release the shoulder. We can see a couple of small fasciculations with that happening, and again, the patient should experience a dull, achy sensation. Finally, we are hitting the deltoid muscle. And again, it's always important to palpate the borders, know exactly where you are. Coming down, insertion, and then looking good for that fasciculation. There you go. And again, getting nice dull heaviness sensation as a response. And that is a typical shoulder treatment. Thank you for joining me today, and please visit our website for appointment times, and don't hesitate to contact us if you have any other questions about the services that we provide and how they can benefit you. Have a great day.